Welcome to Adapt NCLEX. Let's practice 85 questions, like a simulation of the exams, basically based on NCLEX review concept you have to know. You can use it as a guide as you go through your studies. Pause the video, answer it, listen to me, and see how I answer it. I'll try to be quick, but I'll emphasize key points, highlighting key points that you're supposed to know. So buckle up and let's go. Second one, this is to highlight some concept. What is the next calculated total body surface area? A client present to the emergency room after house fire. Assessment reveal, look at the word, full thickness. There's the reason why there's something in front of thickness, burn to anterior portion of the right and left extremities. Superficial burn to the entire right upper extremity. So you draw your caricature, right? And then this is the left, this is the right, this is where you're facing the patient left. So what do we have? Full thickness burn to anterior portion of the right. So the whole of this is burn and the left is burn. So the whole of this is 9. The whole of this is 9, right? So 9, 9 anterior in front. Just the front portion is 9, 9. Then they say what? Superficial burn to the entire right upper extremity. So the whole of this front and back, superficial burn. The key word is superficial. We don't include superficial in the burn wound calculation. We use full thickness and partial thickness. Therefore, even though this is all burn, this will be probably 9 plus and 9 total. Don't add this to that. So the only thing you can add is 9 and 9. That is the full thickness. Superficial burn is not calculated. So this is wrong, this is wrong, this is wrong. 18. So this anterior portion. That's the concept I want to emphasize. Number 3. Which of the following shows adherence to Muslim practice by the nurse? Like it says, pause it, answer it, then listen to what I have to say. That means a patient is a Muslim, okay? A new graduate is caring for a Muslim client who died from pulmonary embolism. Just die, okay? What should the nurse do to indicate that she understands Muslim practice? A dead person who is a Muslim should be facing east. That's all. So north, south, and west are wrong. Key is east. That's the practice. Number 4. Select or apply. You can see I start moving from the back. That's the way I answer questions. So that's the way you should do. Which of the following teaching is appropriate? Looking for appropriate teaching. New graduate is teaching a client on constipation prevention. I want to prevent constipation. Key fact, hydration, fiber, exercise. Don't use any laxative. Ensure adequate vitamin D intake. No, we don't need vitamin D. Eat fruits and vegetables. Yes, some fiber in it. Ensure intake of bulk-forming agent. Bulk-forming agent is metamucil, citrucil, benefiber. These are all fiber bulking agent. So ensure intake of 1 liter of fluid. Yeah, you saw fluid, but you forget that there's 1 liter in front. It's not enough. You need 2 to 3 liters. So this is wrong. Ensure a walk in the park, okay, 30 minutes, 3 times a week. Okay, 30 minutes, 3 times a week is considered a moderate exercise. So the patient is doing a moderate exercise, so that's good. So 2, 3, and 5. 2, 3, and 5 are your answer choice. Select or apply. Once again, if you're not sure of it, just leave it. Pick those you're confident, okay? You're confident about 99 or 100.1%, okay? Select or apply. Again, a bunch of SATA to keep you confident, right? Which ethical principle the nurse should follow? A new graduate is caring for a client who had a biopsy that shows invasive colon cancer after colonoscopy. Client does not want the spouse to know about it. Had biopsy, show cancer. I don't want my spouse to know about it. What ethical principle the nurse should follow? Autonomy? No, that's me making my own decision. Veracity? No. Beneficent? Do no. To anybody? I mean, normal efficiency, it's not the right answer. Confidentiality is your best answer because the client told you not to tell anybody, so don't tell anybody about it at all. You just have to listen to what the patient is telling you. Autonomy, the patient make that decision. So she has autonomy not to tell the husband, right? Veracity, you got to be truthful to the husband and the patient, but the patient said, don't tell. So the patient you're taking care of is the patient. So be truthful to the patient and when she said, don't tell, okay? Beneficent, yeah, be good. So, right, be good. And normal physics, do not do any harm. And confidentiality is being confidential. Don't share any information without the authority of the patient. So these words, you have to know them and use it as to answer the question. So this is the ethical principle you need to follow. Number 6. What patient history makes this drug a contraindication? So some medication I'm worried about. A G1P1 present to the postpartum ward after prolonged labor and delivery. Client saturate 5 pads in an hour. Methylergonovine was prescribed. Rewrite them in your own word. Something bad, contraindication. I cannot use it. I'm saturating 5 pads afterward. Those are the bars. 5 pads after a prolonged labor, that means I'm bleeding. So all this is a rewrite. I said postpartum hemorrhage. And what medication do I prescribe? Methylergonovine. You know that this is a drug to prevent what? Postpartum hemorrhage, or to treat it. How does he do that? It causes vasoconstriction. Therefore, you should avoid in any condition that will worsen vasoconstriction, like coronary disease can worsen this condition, hypertension, and patient who has stroke, it can cause stroke. So these are conditions you should avoid it. Asthma, GERD, obesity, hypertension, they will worsen the hypertension. So we should not give it to this patient. You write a question your own ways and turn it the way you're more confident, and you can be able to see what the question is asking by reading from the back. That's words for life. Same question, same strategy. Which of the following need to be stopped? I need to stop it before administering the medication. A new graduate is caring for a client with a grand mal seizure, right? Who was prescribed what? Phenytoin. Therefore, rewrite, stop some medication because of I'm going to give phenytoin. And what you know is phenytoin hate protein. That's number 1. Right? It hate protein. Therefore, and it can be put in normal saline. So this is good. LR is good, and that is good. Albumin 3% is a form of protein, so you should not put it in the run it together. So I need to stop this. The same thing, patients getting 2 feeds, don't give it to them. So that's the key point I want to emphasize. Phenytoin, seizure medication, hate protein, it affect absorption. Albumin is a protein. A case study for you. Like I told you, 85 simulating the test, right? Which of the following is indicated or not? The client present to the emergency room complaint of what? Heart skipping, buzzword. They always put it in the first 2 sentences. Beating and racing, so some palpitation. He has a history of hypertension and polylipidemia. He denied tobacco or alcohol. He take what? Hydrochlorothiazide and atorvastatin. EKG shows what? Irregular rhythm, right? Many P waves. QRS is less than 120. Systolic blood pressure is normal. You have to be able to identify EKG just by what? Reading it without not looking at the EKG. I have a YouTube shop, very easy, that can give you all the 9 key EKGs. So check it out. EKG shows what? Irregular rhythm. There's only few that will give you irregular rhythm. Sometimes block or AFib. So either they have a block or they have AFib. Then the next step is they have many P waves. Blocks does not have many P waves. Sometimes they're losing P waves. That's your key. This patient is in AFib. What is indicated? Start warfarin? No. Rate control is number 1. Diatasm, excellent. It has to be in the tele unit, excellent. Thyroid function test, yeah, to make sure this is not hyperthyroidism causing it. Yes. Echocardiogram, yes. Sometimes they already had clot, so you need to check it. All these things very important. But start warfarin is not indicated. So straightforward case study. Assignment. Which room assignment is consistent with infection control protocol? I try to get you thinking, flip you back and forth. So client with MRSA. So the protocol is what? Same organism. Okay. You're going to have the same organism, not the precaution, right? You don't infect one person. MRSA and RSV, they all contact precaution, but different organisms. So gone. Parvo B virus and a client with VRE. VRE is what? Contact. This is droplet. We can be together. Scabies, client with adenovirus. Contact, right? He has some contact effect. Adeno has both contact and droplet. Contact and droplet. Still, we are not the same guy. Appendicitis patient and the client with what? Bowel obstruction. This had surgery. It just is an obstruction. It cannot infect each other. So we are good. This is not infectious just by having NG tubing. So this assignment is consistent with infection control protocol. Which client do you see first? You got to be sharp. And be sharp, you know what be sharp is. Breathing, electrolyte, shock, sepsis, airway, neurological, and a pain problem, right? Those are the most important. But you got to be sharp. High Fowler position 1 hour after kidney biopsy, where the kidney is on your back. If you biopsy it, they're going to bleed. The way to put pressure there is to put the patient on their back. So supine. I'm not happy about you. Select or apply. So that means there may be more than one. So this patient is in the wrong position. Right shoulder pain after cholecystectomy. Gallbladder is on the right upper abdomen. If you remove the gallbladder, pain can radiate. Refer pain to the right shoulder. This is fine. Palpitation after levothyroxine in hypothyroid patient. Patient is hypothyroid patient. I give them thyroid hormone. Thyroid hormone increase your metabolic rate, increase your heart rate. As you see palpitation, don't worry about it. Constipation after dicyclomia. This is an anticholinergic. You're going to have constipation. Headache after hypotension. Hypotension is going to increase your hematocrit, right? When hematocrit become really high, you're going to have what? High volume. Your blood volume goes up and you become hypertensive and you stroke because it's too viscous. Therefore, headache is dangerous. Headache is a early sign that you get into trouble with hypotension. So 1 and 4 are those that you need to pick. If you only know one, just pick one. Okay, just pick one. You get partial credit. You're not going to get 0. If there's 2 answers, I pick 1, partial credit. If you think you don't know it, just leave it alone. But I know you know it. So pick the right answer, and the computer will shut off early. Number 11. Which of the following the nurse should indicate as a priority? Number 1, side effect for the medication. A nurse is teaching you graduate about Clozapine. Rewrite it. I'm taking clozapine. What should I worry about? What you should worry about? Something that is going to kill the patient, and you have to be sharp. And how do you be sharp? You already know it. So what is the side effect of clozapine? Weight gain, hyperglycemia. It increases your prolactin level. They will, like, if it's a male, they will be having milk coming up from the breast. Risk of sepsis, right? This is agranulocytosis. I do not want to write it so that you can get the right answer right away. Which of these is more dangerous? Is sepsis on B sharp. So this is my priority. This one, we can deal with it later on. EKG. What is the next best action? Next. A client without pulse. He has no pulse. Cardiac monitor show the rhythm below. A client without pulse, cardiac monitor show the rhythm below. This is what we have. I have no pulse. What would you do? Does it look like it's a sinus rhythm, but I have good electrical activity, but I have no pulse. This is what we call pulseless electrical activity, PEA. This is treated as the same as patient as asystole. Therefore, immediate defibrillation, no. Cardioversion, no. 1 milligram of epi, you will need it, but it's not test-taking skills. The next best action is high-quality CPR, like you do for asystole. Number 13. A nurse is caring for a client who overdosed on acetaminophen. Which medication the nurse should anticipate? Straightforward question. Acetaminophen, you have to know. This is content, you have to bring it. There's nothing I give you in the question. Straightforward, you have to know it. Vitamin K, you know what it is. It's warfarin, right? Phentolamine, yeah, it's norepinephrine vasopressin. Protamine is what? Heparin. This is your boy. And this is like opioid. You have to know that. Next question. What Erikson developmental stage the nurse should teach the new graduate to apply in the formulation of the treatment plan? A bunch of words. What is that? And nurse is caring for, you see, I read this, I said, oh, it's a bunch of words. I know what I'm looking for, just the stage. 5-year-old client with a new graduate. So 5-year-old, what do they need? Well, you have to know the stages. So the first stage, you know, is mistrust and trust. So 0 to 1. Then 1 to 3, they start, that's the early childhood. They start taking what we call autonomy and shame after they trust you. Then after that, before they start becoming initiative, that means from 3 to 5 years or 3 to 6 years. That's when they start taking initiative. Integrity and despair is older patient. That's the end of life. Identity role confusion is adolescents. They go into high school, they don't know who they are. They start dressing some way. They're trying to figure out who they are. And they're wearing shoes, they're cutting their hair a certain way that is inappropriate. So that's the identity role confusion. Autonomy and shame is the next stage, like 1 to 3 years old, after they pass the mistrust and trust. So initiative and guilt is your right answer. Okay. You have to know this. There's not easy way to teach you. Next question. Which of the following is expected or not expected by the nurse? A nurse is caring for a client with central venous pressure of 3. This is content. CVP is 3. You ask yourself, what is CVP? Central venous pressure, and the normal is 2 to 8. If I give you CVP of 3, that's normal range. It's in the low normal range. So it's still what? Normal. I don't want it to be 10. So it's still normal. You get leg edema? No. You have new S3, that means heart failure? No. Your urine output will be normal, 35 cc ml per hour. pink fluid sputum, that means you have pulmonary edema? No. And your blood pressure may be normal. This is a trap question to get you thinking. CVP is normal. I expect normal findings. Another question. Which of the following is expected or not expected by the nurse? What is the problem? A nurse is caring for a client after a brain tumor resection, had surgery. 2 hours ago, urine output is what? 800. That's too much in 200. That means client is paying 400 ml per hour. And you know something is wrong, right? This may be diabetes insipidus. Okay, it's not mellitus, insipidus. I'm paying too much. Okay, in a very short time, 400 an hour, that's too much. By the end of the day, it's over in 4 liters. So, what do you think? DI, well, I don't have ADH. Therefore, my urine is going to be like diluted. Serum osmolarity is 250. It's too low. It's not expected. If you have DI, serum osmolarity goes up. Serum sodium goes up, yes. Urine specific gravity, this is too high. Urine specific gravity normal is 0.003 to 1.0030, right? This is normal. This is the maximum normal. If it's greater than 1.035, now this is high. I expect my urine specific gravity to be low. Pungent smell urine, yeah, this is not, the urine is diluted, so it's not going to be concentrated. Urine sodium is going to be low because the urine is diluted. So this is what is expected. This is not what is expected. Endocrine. 17. Saturn. A nurse is caring for 5 clients. The charge nurse on the unit will intervene on which client? Something is wrong. Scabies, right? In private room. Yeah, it's a contact, so we're good. Pertussis wearing surgical mask in the hallway. Droplet wearing surgical mask in the hallway is okay. TB wearing N95 on the hallway to CT is okay, but not N95. They wear surgical mask, so we got to intervene. HIV wearing surgical mask to X-ray. HIV is what? Standard precaution. There's no need to wear anything. MRSA in the private room is contact, so private room is good. So 3 and 5. Select or apply, pick those that you know. So but 3 and 4 on the right hand side. 3, 4. That's the one we got to intervene. The rest is fine. Number 8. A nurse is caring for a client scheduled for what? Hemodialysis at 9 a.m. early in the morning. Which of the following actions by the nurse will cause the charge nurse on the unit to intervene? The same thing, select or apply. If you don't know it, leave it, but break the question down. Patient is having hemodialysis in the morning. What are the things you should hold and not hold during hemodialysis, or you should do? Allow patient to eat. Yeah, they're going to be there sometime 5, 6, 7 hours. Well, you should eat, so I'm not going to intervene. Hold their blood pressure. Yeah, the blood pressure is going to drop during hemodialysis, so hold your blood pressure. This, I don't need to intervene. Carbamazepine, this is for seizure. Mood stabilizers also. I don't want them to seize when they are getting dialysis, so you should give it to them. Digoxin, so is also anti-arrhythmia. I don't want them to have a arrhythmia when they're getting hemodialysis with all electrolyte changes. Yes, you should not hold it. So I need to intervene. Hold all medication, of course. If I'm not holding this, this is wrong. Hold sulfonylurea. If they're eating, well, I don't want their sugar to go up. So the key thing is they can eat seizure medication and an antiarrhythmic. Those one you have to give it to me. The most important medication usually you hold is blood pressure because they will become hypotensive. So this one, patient eating, holding this is fine, but holding carbamazepine, this all medication, and that is wrong. So I need to intervene. Next question. Which of the following is a prioritization? A nurse is caring for a client with end-stage renal disease admitted for worsening renal failure. An internal jugular permacat tunnel was placed for dialysis. All it means is patient has renal failure. They come in, apply a catheter in their neck for dialysis. Remember, this is emergency, so this is not a permanent catheter. This is temporary to give it to them. Therefore, what do you think? Palpate atrial? No, this is usually when you create a fistula or graft, because it needs it needs time to mature. It takes like 2 to 3 months for you to see a atrial or a bruit, and they have not matured. This just happened. These ones, they don't do that because it's going through the vein. If this is the vein, I just put in like IV. I'm not connecting the artery and the graft together and sewing it. The bruit and the trail are caused by creating a fistula connection between two things. This is not a connection. I just stick the vein and I put the catheter in. So I won't see a bruit either. Infuse normal saline via the line. That you should don't put anything through it until they tell you to do that. So keep the catheter sterile so it does not get infected. It's the most important, okay? Next question. Select 3 answers, only 3. A client presents to the emergency room with 3 days of what? Left lower quadrant pain, fever, and nausea, okay? Well, temperature was 101.5, heart rate is 100, blood pressure is this, and this is the virus. Y count 15,000, CT scan, inflammation around the sigmoid. So they came in and they have pain here, and there's inflammation on the left lower quadrant. What do you think? Make a diagnosis. This is what? Diverticulitis. And with diverticulitis, GI problem, what do? NPO, IV fluid, NG tube, antibiotic, and then pain management, right? But not everybody need all of them. That's for normal GI to happen, but not all of them. So you see which one is applied to this problem. Diverticulitis, yeah, NPO. Is it vomiting? Yes, nausea. He's not vomiting, so NG tube is not indicated. NG tube usually for obstruction or pancreatitis, but colonoscopy, don't put anything down there that will perforate the colon. So this is not indicated. IV fluid, yes. Do they need surgery right away? No. They have to wait, treat them with antibiotic, and if it doesn't not resolve, then they will need surgery. Metronidazole is an antibiotic. And so I'll choose this. I'll choose 3. NPO, IV fluid, antibiotic. Straightforward. Next question. Which teaching is appropriate for non-weight bearing clients with the left ankle fracture? So I have left fracture, okay? I cannot bear weight. And I have crutches. How do I walk? Go up the stairs first with the left leg. Bad leg up? No. Good leg up. Wrong right away. Keep the crutches 20 inches in front of me. Too long, 15. Okay, maximum 15 inches. Move the left leg and the crutches together. Bad leg and the good leg together first when walking. Yes, that's 3-point stand, right? Both, then the good leg follow. Bear weight on your armpit, negative. You get palsy of your nerve, median nerve palsy or ulnar nerve. You should bear weight on your elbow. You bend it at 20 to 30 degrees. So this is the right answer. Next question. Which technique is appropriate when administering enoxaparin for a client with a BMI of 40? It's a big patient, so this is a strategy. I have a thick lady or male, and I'm going to inject enoxaparin. The key teaching point scales is if I can pinch 2 centimeters, I have to go perpendicular and 90 degrees. If I cannot, then I have to go 45 degrees. So if you can pinch more than, so if it's less than 2 centimeters of the skin fat, you can pinch. Yeah. The other thing too, you don't go to the muscle. So test taking skills. Muscle, I can say you. Muscle, I can say you. So I only have 2 answers now. Then I see which is 90 and which is 45. So this is 90. So I can inject more than, I can pinch more than 2 centimeters. So I choose D. Number 4 is the right answer. So, which of the following is indicated or not? A client was prescribed rosuvastatin for hyperlipidemia. It's a straightforward question. All you have to say is prescribe statin. Which one is indicated? What is he going to do? It's for cholesterol problem. It affects the liver. If it affects the liver, baseline LFT is indicated. Your goal of LDL less than 100, less than 150 is wrong. You want it to be less than 100. So this is not. Goal of HDL need to be higher, 45 and 50. Sometimes 50 is best. Going up a higher level, that's what confusion. HDL means high, LDL means low. So I want my HDL to be high and my LDL to be low. So this is not indicated. Take med in the morning. You make cholesterol in the evening. So these are taken in the evening, not indicated. Call with muscle pain. Yeah, rhabdomyolysis is dangerous for this patient. So these are the one indicated. These are not indicated. Like I said, these are concepts I just want you should know by now. So the next note that this is referred to as what? This is referred to as what, right? A nurse is caring for a client in the nursing home who is afraid of being alone due to recent death of the spouse. Spouse died, client is afraid. So this is phobia. You have to know. Certain phobia. So what? Plutophobia, well, this is what? They don't like to be reached. Normal phobia is phone. Your phone lost and you're going crazy. So you don't want to be without phone. So no, without phone. If I don't want to be without phone, yeah, abnormal phobia. Monophobia, yeah, being alone, afraid of being alone. And gamo is gamete, right? Being married, and then or commitment. So I don't want to be in married or be committed to somebody else. That's gamo. And mono means alone. So this one. Next question. What defense mechanism the client is exhibiting? A nurse is caring for a client who said, I hate John in my class, but we are friends now and I'm nice to him. I hate John. First you hate him, but you are friends now. Why? Your feeling that you were having, you just basically acting opposite. And now it's nice to you because you acting opposite to your feeling. I'm not acting opposite to my feeling if I'm in denial, right? Sublimation, basically you changing the bad thing into a good thing. She's not changing into that bad feeling. Reaction formation, yeah, we're reacting opposite to what you're feeling. Projection, there's no projection yet. So this one is the right answer. 8 clients needed bed assignment in the med-surg unit. Which assignment is consistent with standard acceptable protocol? Sometimes I try to use some words to confuse you because they can do that. It's easy. Which one is appropriate? Okay, which pairing is appropriate? I have appendectomy 3 hours ago and I have fever unknown. You can't put me together. Yeah, this guy has infection. This is surgery right away. No. Small bowel obstruction and brachytherapy. No brainer, right? You're getting radiate therapy, internal radiation, somebody obstruction. You should be alone. Myocardial infarction and I'm bleeding. Yeah, heart attack and esophageal bleeding, they can be together. They're not going to infect each other. On clozapine and then somebody with adenovirus, where you worry about sepsis in this patient, and that somebody who has contact precaution and droplet, you should not put them together. So this is the right answer, number 3. Which of these clients have the highest risk of suicide? So who are highest risk of suicide? It's a select or apply. All of them have depression. What is different is here. Pregnancy is protective. If you are in the church, it's protective. If you have job, it's protective. So this guy, if you married, this guy is divorced, living in a family support. So 3 and 4 are bad, high risk. They all have depression, but these 2 is alone. They have a higher risk of depression and suicide. Next question. Which of the following need intervention? A nurse is caring for a client with what? Chest tube due to what? Pneumothorax. I have pneumothorax, right? Which one? You have to know these things about chest tube. The Pruravak is tape. So this is the Pruravak. Is tape on the floor. Usually tape on the floor so that it doesn't move. It has some stretches there. You can tape it on the floor. It's wrong because somebody can kick it, even though it's tape, and they kick it on the floor and they get dislodged. So this need intervention. You should put it on the non-movable aspect of the bed. Kool-Aid-like fluid in the collection chamber. So this is the collection chamber. Go to the patient and you see some Kool-Aid. That means pink-like. Yeah, does not need intervention. Continuously bubbling in the hair leak chamber. Air leak chamber, there should not be continuous bubbling. There should be intermittent, or there should be no bubbling at all. So this, I need intervention. Client complain of pain with inspiration at the insertion site. Yeah, this is you. This is going to your chest. If you take a deep breath, well, you expect pain here. Don't worry about it. No bubbling in the collection chamber. This is the collection chamber. Things are coming here. There should be no suction there. So this is okay. So the only thing that need help, you tape in the Pruravak, and then you have continuous bubbling in the air leak chamber. So 1 and 3. Next question. Which delegation is appropriate? Select or apply. You pick those you know, you're confident. A nursing team is made up of what? RN, LPN, and UAP caring for AFib patient. Which delegation is appropriate? RN administer a drip. Yeah, this is high maintenance medication. So this is good. UAP assist client to the bathroom. So yeah, they don't have to worry about it. LPN reinforce. That's what they do. Reinforcement teaching on warfarin. UAP replaces the SCDs after ambulation. Yeah, he walk the patient and he places the thing back. LPN provide discharge instruction to the client. No, they don't provide discharge teaching. So it's RN, UDA assessment teaching and all those things. So this is not appropriate. So this is wrong. Which of delegations is appropriate? 1, 2, 3, 4 is appropriate. Next question. Which plan of care is indicated or not indicated? A 2-month-old was brought to the emergency room due to what? Excessive runny nose. I told you when you see a case, look for Boswell's. Excessive runny nose, and it's 2-month-old. There's a reason why they give you the age. Decreased oral intake, no eating, and fever. Exams reveal moderate stridor. Which plan of care is indicated? So runny nose, I can't eat, I have fever, and I have stridor. What do you think? This is RSV, respiratory syncytial virus infection, based on the age, 2-month-old. So what do? This is it droplet or what? So this is not droplet. It's a so it's mostly contact precaution. So it's a contact precaution. So it's not indicated. The kid needs some fluid. You don't need to do deep nasal suction. So deep nasal suction is not indicated. Racemic nebulized epinephrine is because of the stridor. So this is indicated in supplementary oxygen. I know some people will say, oh, there may be some and droplet precaution. Mostly this is a RSV is mostly contact. So that's why this is not indicated. Deep nasal suction is not indicated. Just you suck the nasal right at the tip of the nose. You don't have to jam in all the way. And then because they're striding, you need to give them epinephrine, take away the edema, and give them supplementary oxygen. Number 31. Select or apply. Which of the following is very concerning? Bad stuff happening. A nurse is caring for a client who present to the dermatology clinic for evaluation of skin lesion. You see how when I read, I just use words to answer the question. I have skin lesion, rewrite it, and bad word, bad stuff happening. What do you think? Lesion bleed easily. If something is bleeding easily, it's not good. Lesion with different colors, it's not good at all. Same color, uniform is better. Lesion greater than 1 centimeter, about 1 centimeter, yeah. If it's greater than 0.6 centimeters, yeah, I'm in trouble. Lesion with regular edges, no, this is saying the same thing, almost same color, but edges, yeah. If you have regular edges, I'm not worried about you. Lesion with ulceration, it has ulcers in it, it's chronic wound. I'm not happy about it. So 1, 2, 3, and 5 are things you should worry about. Select or apply. If you don't understand it, don't pick it. Otherwise, you lose the point and you get 0 for that question. Next question. Select or apply. Which nerve palsy the nurse should document? A nurse is caring for a client with lack of sensation. This is my face. Lack of sensation on the left side of my face. The client has no issue with smiling. He can smile easily. Patients smile easily. No drooling, yeah, so he can move the muscle. Able to frown. So movement, that means motor is okay, and sensation is affected. Which nerves is involved with that? 2 is not involved with that. 4, not with that. These are all high problem. 5 is trigeminal, right? 6 is abducens. That's also high problem. So this one, they usually uptake vision and acuity and muscle movement of the eye. The only thing you have to worry about is 5 and 7. This is facial. This is for movement. And this is for sensation. So if I come from my face, yeah, that means the facial is fine. But if I don't feel anything, it's trigeminal neuralgia. So this is trigeminal nerve that is affected. That's why I have sensation problem. So there's only one answer choice. If you pick 2, this was a trap. Pick more than 2, you get 0. Next question. Which of the following medication is used for? The client is prescribed what? Gabapentin. Okay, what do you think? This is for nerves, right? Gabapentin is for nerve. It has central peripheral effect. So what is used for? Nerve pain is not for acute. Usually you need like morphine, short-acting medication. Somatic pain is not for that. Visceral is not for that. It's mostly neuropathic. It's very, very good pain. So neuropathic, that's what you use for. If you know the answer, you can just pick it. You can see, I know the word, so I don't even care about the others. Select or apply. 4 questions. It's the trap one. Which of the following client need immediate intervention by the charge nurse based on the diagnosis and medication? So I need immediate intervention. The charge nurse is going to do that based on the diagnosis and the medication given. So there's some teaching here that is bad. So teaching that is bad teaching, right? That's the rewrite. Intervention. I have DVT, You told me increase fresh leafy vegetables while I'm on heparin. I don't need to change my diet when I'm on heparin. So negative. I need to intervene here. Don't change anything. Okay. DVT, decrease your fresh leafy vegetables when you are in what? Gatran, right? If you are in this is factor 10 inhibitor directly, you do not need any change in your vegetables, how much you eat. You eat the same way no matter what. There's no modification. So I need to intervene. DVT, okay? No change in your leafy vegetables on warfarin. Yes, when you're on warfarin, stay the same. Don't change anything so that when you're bleeding, I know that you are in trouble. So I don't need to worry about you. DVT, no change in diet. If you're on apixaban, the same thing, factor 10, you don't need to change anything. The only thing that you need to change is warfarin. And what does that mean changing? Stay the same. Don't move anything at all. So in actual fact, all anticoagulation, you can say all anticoagulation, don't change your diet. You can eat whatever you want, but eat the same amount. So this is just to try to tell you. So the one I need to intervene is heparin does not need, you can tell them to increase their leafy vegetables, dabigatran, you don't tell them to decrease because it's not needed. Warfarin, yeah, but I want you to stay the same. So 1 and 2 is the one that need immediate intervention. Trick question. Next question. Select or that apply. A violent client was physically restrained at the wrist. Okay. Which of the following the nurse should include in the plan of care? This is basically what you do with restraint. Q2, neurovascular check, yes. Reevaluate need for restraint every 4 hours, yes. Renew restraint 6 hours after placement, yeah. You renew it 24 hours. So this is not right. Tie restraint to the movable part of the bed strain. No, that's not right. You should put it at the non-movable. This is going to hurt the patient. Every time patient raise the movable portion, it becomes a problem. Hold all therapy until restraint off. No. You should continue therapy provided their physical needs, okay? Remove restraint and assess client Q1. You do that Q2. Every 2 hours, remove and assess them. So this is not true. So 1 and 2 is the right. You do neurovascular check every 2 hours. That's where you remove the strain and assess the patient and reevaluate the need for restraint 4 hours, and then renew it every 24 hours and remove the restraint and check them every 2 hours. So which of the following should include is 1 and 2? This one is 1 hour no. You don't hold therapy. You don't touch it to the movable portion. You don't renew that. Next question. Which electrolyte abnormality is a priority for the nurse to monitor? The client with hepatitis C underwent liver resection for 6 hours. This is my liver. You cut my liver. Which electrolytes I need to? The liver, when you cut a little bit, is going to regenerate. Regeneration needs ATP. ATP as what? Phosphorus. That's the most important. So in a patient who has liver surgery, I'm looking for their phosphorus. Give them more phosphorus. And the phosphorus will help with the liver regeneration. If it's low, it's going to affect their respiratory status too. So potassium, I know a lot of people choose that. Magnesium is not indicated. So this is a fact you have to know. Phosphorus is what is indicated in liver resection. Next question. Select or apply. And nurse is teaching new graduate about organ transplant, right? Organ transplant. Which ethical principle the nurse should include when discussing organ allocation to a client? All it means is organ transplant. How do they give people those organs? Basically, what do they use? Me, I'm in the hospital. I need a donor. What principle would they use? They are not going to be truthful. It's not that important. I can make my own decision. I can do that, but it does not affect whether I get an organ or not, right? They're going to be good to me, but that's not whether I get organ or not. They're not going to do no harm, but that's not why I get organ or not. It's because they do justice, equal rights. Everybody is equal. Whether you have money, you are black, you green, you yellow, violet, whatever, is equal justice. They will tell you the truth. You can make a decision. They will be good to you. They're not going to do any harm to you. But to get an organ, you have to answer the question. Organ allocation, keywords, that's why I underline. They have to be justice. It does not matter who you are. You get it based on how you listed, and it's based on equal rights. Number 38, select or apply. Which of the following the nurse must include in the teaching? A nurse is teaching new graduate about mandatory reporting. So which one is mandatory? Deadly abuse, yes. Only confirmed child abuse, buzzwords. You should know, pay attention. These are distractors. Only is an absolute. Any suspicion of elderly abuse, any suspicion of child abuse is indicated. So this is wrong. Syphilis, yes. Certain infection, gonorrhea, and child neglect, you have to report it. Next question. Which of the following the nurse must include in the teaching? Okay. A nurse is teaching new graduate about what? Advanced directives. These are things you need to know. What is advanced directive? It's a living will and power of attorney. And what do they mean? Living will, client delegate decision to another. No, that's not delegate. It make the decision now. You write it on a paper and it give it to you. This is what I want you to do. Just follow it. So I'm not delegating anything. Living will, signed document cannot be changed. It can be changed. The word is cannot. Absolutely no. Power of attorney. I assign somebody to make a decision with me, for me, when I'm not available. No, I'm not able to do that. The person is going to make a decision based on my best interest if I'm not able to. So client delegate decision to another, yes. And that person make a decision when the client cannot in the future. Designated patient make decision not right away when I'm not able to do that. So number 3 is the right answer. So which of the following the nurse must include in the teaching? A nurse is teaching new graduate about fire extinguishers. What do you do? Steps, push, you don't push, right? You pull. When you pull, then you aim. When you aim, you squeeze. And when you squeeze, you sweep. So what should I include? Not the push. I aim. I don't sway. I sweep. So 1 and 3, 2 and 2, 1 and 3 are wrong because this has to be pushed. This has to be squeezed. And 2 and 4 are right. Straightforward, right? Next question. Which of the following vaccine is contraindicated in a leukemia patient receiving chemotherapy? Rewrite it. Select or apply. I have chemo while I'm a leukemia patient getting chemo, and which of these I cannot get? Oral polio, no, you can get the IM one. Nasal one, no, you can get IM one. MMRI, you can get it. Tdap, you can get it. So which one is contraindicated? This, and that. If you're getting chemotherapy, these are all live vaccines. contraindicated. So 1, 2, 3 is contraindicated. Next question. Select or apply. And this is caring for a client with the strip below on the cardiac monitor. Client is what? That's where diaphoretic and dizzy. Which of the following are indicated? Rewrite it back. I saw this rhythm. My patient is sweaty, is dizzy. What would I do? What do you think? This is bradycardia, right? It's too long. 1, 2, 3. If you count, you can see that this is too long. RR interval is too long. So this is bradycardia. Bradycardia, you don't defibrillate them. You don't pour ice in their face. This is no SVT to cool them down. Assess for chest pain, yeah. They may be symptomatic too. They may be heart attack, right? Place transcutaneous spacer on the client. Is symptomatic, yes. Amiodarone drip is going to drop their heart rate more down. This is antiarrhythmic. It drops it down. So this is not indicated. So 3 and 4 are indicated. Number 5. And let's give a report to the night shift nurse. Which client must be seen first? You have to be sharp. I have a cirrhosis patient. ALT is 3 times normal. That's why they have cirrhosis. That's fine. Strep pneumonia, temperature of 103, receiving antibiotic. What else can you do? Just watch them. Yes, pneumonia. The temperature is 103. That's what I expect with pneumonia. And what are we doing? Giving them antibiotic and being sharp. Just ignore them now. Myasthenia gravis, weakness at night. That's what happened. They're stronger during the day, weaker during the night. Don't worry about it. I have a femur fracture, big bone. Now I'm restless, be sharp, and petechiae on my chest, fat embolism. Please see me. Next question. Select or apply. Which of the following conditions the nurse should anticipate the medication can be used to treat? What do you think? A nurse is caring for a client with what? Prescribed fluoxetine. Remember it, right? You have to know these pharmacology medication. This is SSRI. What is used for? No, bipolar. It's not a mood stabilizer. It can be used for depression. It's not antipsychotic. It can be used for anxiety. And what is the problem with these people? Bulimia, weight issue. So this will let them eat and they will gain weight. So this is good. Next question. Select or apply, right? Pick those you're confident. And next is caring for a client with what? Pertussis. What do you think? Which of the following plan of care is consistent with the infections control shown below? What do you think? So what do you think? Airborne pertussis is droplet. So it's not airborne. So which of the following is consistent with the infections control? This is not. Private room, yeah, yes, droplet infection, nothing wrong with it. Client wears surgical mask in the room. They don't need to wear anything in their room. If they walk in the hallway, yeah, they can wear a surgical mask, but this is not right. Client in negative pressure. No, they don't need negative pressure. They are not airborne precaution. Client wears surgical mask when walking in the hallway. Yes, so this is fine. Airborne is wrong. Wearing surgical mask in the room is wrong. Negative pressure is also wrong. But wearing surgical mask when walking in the hallway is right. 3 and 5, right answer. Highlighted information, being fancy, right? Select only 3. 45-year-old female present to the emergency room with mid-epigastric pain, nausea after eating at the cheese factory. Buzzword. Reports similar episode a month ago after hamburger sandwich. Buzzword. Temperature 101, heart rate is this, blood pressure is that, respiratory rate is that, and a SAT is that. White count is 12,000. Which of the highlighted need further intervention? Need further intervention. Yeah, so this is intervention. So mid-epigastric pain, hamburger sandwich, temperature. This, what do you think this patient have? So F here, 45 fat. Eat some fatty food, and they have pain in the right upper quadrant. At similar episode, a fever now. So this is what? Cholecystitis. So which one need further intervention? My pain. Hamburger sandwich, no. I have fever. My rate is normal. And my white count is this. Among those highlighted, this is one that will give you information with the diagnosis of cholecystitis. Next question. A nurse complete a course in management of care. The nurse should know that the process, big word, that focus on assessment of the outcome to improve quality care by identifying what? Performance deficiency is what? A bunch of words. But when they give you this, the strategy to answer this kind of question is look at the words you have underlined and put it together. There's quality. There's a quality improvement by identifying performance. So it's not just quality. Evidence-based research is off. Qualified control, right? And it should say quality. This is quality control. There's quality there, right? There's control there, but that is not all that is going on. The main thing is by identifying performance deficiency. So this is what we're trying to do. Performance improvement study is that. That's what we are doing here. Next question. Determine the leadership style. So these are some management questions. And next manager delegates unit scheduling to the staff. Just delegate. Does not want to do the scheduling. Manager does not get involved at all. So what is she doing? It's not authoritative. It's not give them order. Democratic is not involved making any decision about it. So it cannot be autocratic. And this is the same answer. So it's, let's see, basically let them do their own thing and come to me after you figure it out. Next question. Which medication the nurse will recommend? A nurse is caring for a client who need around-the-clock pain management. So getting pain management consistently, baseline. Morphine does not do that. That's why we give it every 4 hours, right? Or every 2 hours, every 3 hours. Ketorolac, we give it, just one is for acute pain to help with your pain. You have to go back every 6-8 hours. Acetaminophen, the same thing. Transdermal, I slap it on you, it will give you 72 hours around the clock. You're getting pain medication around the clock. So this is good. Next question. Who need to be seen first? A nurse is in the multi-trauma scene. Who need to be seen? Look for the red, look for the black, eliminate the black, and pick the red. Black means you dead. There's nothing I can do to you. I can see your brain. You can't breathe, nothing. GCS of 3 is black. You dead. Small multiple laceration all over the body. This may be green and yellow. I don't care about it. Left amputation by what? Apneic. Even though amputation make you red, you already not breathing. So this is also black. Chest wound. So I'm left with this. This is the strategy to answer this question. So chest wound is a red. Next question. Which of these actions is a priority? A nurse is caring for a client receiving chemotherapy for leukemia. Buzzword. I have chemotherapy. I have leukemia. I'm getting chemo. What do you want to prevent? Infection, 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 infection. Keep the door closed. Okay, fine. Private room, fine. Cluster care, fine. Look at it. I can do this, or But if I don't wash my hands and bring the germ to you, you're in trouble. So hand hygiene is the most important. So the nurse need to wash the hands, make sure getting hand hygiene. Select or apply. Pick those you know you confident. A nurse is caring for a client on a ventilator. The nurse is assessing for ongoing what? Low pressure alarm. Low pressure alarm means there is no flow. There is an opening, there's a leak somewhere, or patient is extubated, does not have the ventilator anymore. It's not intubated. He put a tube from his nose, his mouth, or wherever they put it. Pneumothorax will cause high pressure. Mucus plug, high pressure. Biting of tongue, high pressure. Calf leak, low pressure. Kink, high pressure. One answer. Select or apply. Pick those you know you're confident, 100%, right? So one answer. More than one answer, you're wrong. But based on your content, you know calf leak is the best way. Next question. Which of these may be the cause, right? The nurse is caring for 5 patients. The lab call for ABG as that. So 7.5 is acidosis. My bicarb is 35. It has gone up more than I need to. 20, yeah, 22 has gone to like 35. So I know right away it's metabolic. My PCO2 is almost normal. Therefore, this is metabolic acidosis. I'm looking for metabolic acidosis, right? NG tube, metabolic acidosis. Diarrhea is opposite, right? Crohn's disease, what do you think? Adulteron level? Yeah. That's metabolic acidosis. Bicarb infusion, I'm giving you bicarb, metabolic acidosis. Aspirin toxicity, this is acidosis. Dimers, this is also acidosis. This causes metabolic acidosis because it prevents you from absorbing, it decreases your bicarb. Aspirin causes acidosis, and diarrhea also decreases your bicarb. So this is acidosis. And the rest is this is acidosis. So 1, 3, and 4 are your right answer. And thus this is gone. Next answer. Question. Which of the following is indicated? A nurse is caring for a client in acute asthma, exacerbation, acute. The word is acute, buzzword. When you answer a question, don't qualify it. Don't let them go take away the qualifiers from you. Acute. That means immediately. You have to do something. I'm looking forward. Short acting stuff. You see what I did? Rewrite the whole thing. Short question. I also make it short. Short acting. Thus, it's not a short acting. It's a long acting. Theophylline is a long acting. This anticholinergic is a short acting. Ipratropine. Tabitolin is a long acting. And fluticasone is a short acting. So what do you need? Short acting. Steroid. This is steroid is anticholinergic. And bronchodilator. Next question. The nurse know that this mother is referring to what? What is she referring to? G1, first pregnancy, 17 weeks, presented the whole big clinic for evaluation. Report feeling the baby moves a lot. Yeah, 17 weeks, you should not be feeling baby moves a lot. It's not that developed. So it's a fake movement. Palatinin baby is kicking up and down, rebound. That's not the definition. Feeling baby move. Preterm labor, baby is not contracting yet. Quickening is what she's referring. There's no contraction. So this is quickening. She's referring to quickening. Next question. The nurse will document what? A 23-year-old client present to the OB clinic for evaluation. During examination, the nurse notice, pay attention, softening of the lower portion of the uterus. Then you tell yourself, they're asking you, which one is this? Test taking skills. They said softening of the lower portion of the uterus, and they've given you the diagnosis. They give you what sign it is and that. You know that all this, Chadwick, Goodell, Aga, and Palmer, they are all what? Probable. Okay, they are probable information. Presumptive is the patient, subjective. Probable is objective. You find value. And then the really positive means you can see the fetus. So I know these are all what? Probable. So if I see presumptive, I cancel it. Presumptive, I cancel it. I'm not even looking at the first word. Then I look at the probable, these two. This is talking about the Chadwick, talks about vagina. So bluish color in the vagina. And so the right answer is Erikson. That is the compressibility of the lower uterus. Or the Goodell is basically talking about the cervix is soft. And a Palmer, when you examine them, there's contraction of the uterus. So the right answer is Erikson. It's a probable sign. That's what she's referring to, softening of the lower uterus compressibility. Next question. Which of the following action prioritization? Be sharp. A client hemoglobin 7.5 is not a problem. Need blood transfusion. Which of the following action is a priority? I need to transfuse you. Ensure client as 26. This is too small. 18 to 20 is fine. Or 16 to 20 is fine. So this is not. Prime Y connector with D5 normal. There should be no dextrose. It's usually normal saline. Ensure and verify client identity on the blood product. This is number one. If you go and bring somebody blood to me, I'm in trouble. UAP measure vitals 30 minutes before the transfusion. Yeah, you need vitals, but if you give me somebody blood, I'm in trouble. Verification is number one. That's why you need another provider to verify it with you. Priority 3. 4 is also good. I need to know your vitals before I transfuse it. But what is the most important is prioritization. I need to make sure the blood I'm giving you is yours. That means you sharp. Next question. SATA. Which adverse effect the nurse should include in the teaching? A client with grave disease was prescribed propyluracil, P2U, put you down, tire it down, right? Which adverse effect is indicated? So if you have grave disease, break it down. You're making too much thyroid hormone, okay? And so I give you PTU to knock you down. What is the side effect of this medication? You have to know it's a bad medication. It causes urticaria. It causes agranulocytosis. You know, you have a bunch of medication, 3 medications, you know, Clozapine, Carbamazepine, and then PTU causes agranulocytosis. Severe liver disease. This is the dangerous one. This is number one. You go into hepatic failure. Weight loss. Think about it. If I'm blocking your thyroid hormone, that means you cannot make any more thyroid. You become hypothyroid. Hypothyroid people, they gain weight. So test taking skills and critical thinking. You should not pick this. Even though they have great disease, I've blocked them completely. I've turned them into hypothyroid, so they should gain weight. They also have skin rash. So these are the ones you should include. 1, 2, 3, and 5. Next question. Case form. Small, short one. I don't want to do 6-1. Which of the following is indicated and not indicated? A 2-year-old, age is important, present to the emergency room with the mother due to what? Excessive vomiting after each meal. Buzzword, you should know by now. Vomit described as what? Forceful, buzzword, and voluminous. Kid is hungry all the time despite adequate nutrition provided. So you're giving them adequate nutrition, but they vomit every time they eat. Is voluminous and what? Forceful. There is no choking. No always is good. That means you can rule out other problem. Which of the following is indicated? What do you think this patient have? Pyloric stenosis. What is indicated? IV fluid. Ultrasound to look for the stenosis. Antibiotic? No. BMP, check the electrolyte. Monitor quality of emesis to see if there's bile in it. If there's bile, it may be obstruction. It will be more rotation. So good. So this is what is the right answer. Number 60. Select and apply. Which of the following the nurse would include in the teaching? A nurse is teaching new graduate about possible causes of what? Hyperkalemia. Or you ask yourself, what is going to make my K high? What is this? Bumetanide is what? Loop diuretic. It's diuretic. They never make your potassium high. One of the side effects is hypokalemia. So this is wrong. Crohn's disease. Think about it. This is aldosterone. Aldosterone hates potassium. So you decrease your potassium, you get hypokalemia. Adenosine does not have aldosterone, so there is no ado. Therefore, potassium is happy. So K is high. So this K is high. Renal failure, you know, everybody who has kidney problem, he can secrete potassium. So potassium is high. Prolonged NG tube, you get what? Metabolic alkalosis, and your potassium is low. So which of these causes hyperkalemia? 3 and 4 are your right answer. Next question. SATA, select that you know is the right answer. If you can, leave it below. And nurse is teaching client about food items to avoid after prescription for what? Spironolactone. Which of the following the nurse will include in the teaching? Including in the teaching, spironolactone, breaking the question down, teaching about spironolactone, and I need to do what? Include it. Rewriting them in my own words. Spironolactone is K sparing. That means I'm sparing potassium. Therefore, I don't want any more K. Potato, like K. Avocado, like K. Tomato, like K. Banana, like K. Rice, nothing. So this is the only thing you can eat. You cannot eat any of this white rice. Avoid all those things. So the right answer, which of the following the nurse will include in the teaching is what? Potato, don't eat potato, don't eat avocado, don't eat tomato, and don't eat banana. You're okay to eat. So the right answer you're going to pick is 1, 2, 3, 4 should be included in the teaching. I know sometimes it's confusing. I put check mark here. It doesn't mean that's the right answer. That means this is good. This I need to put in the teaching. So that's what they need. Next question, right? Select all that apply. A nurse is caring for a 2-week-old infant. It's 2-week-old. Which of the following the nurse will prioritize? You have to know their vitals. Respiratory of what? 40, usually like 30 to 60, right? Heart rate of 170 when cry. It's 110 to 160. When they cry, it can go to 180. So this is good. Blood pressure, this is normal. Heart rate of 104, this is bad. That's bradycardia for them because it's 110 is the lowest, it's 2-week-old. So this, I need to pay attention to that. Even though it look normal, that's wrong. Next question. Select that apply, right? Which of the following action are expected or not expected? A nurse is caring for an adult client in asystole. It's in asystole. Okay. Cardiac resuscitation was initiated. So you are in asystole and you start cardiac resuscitation, right? What do? Compression rate of what? 100 to 120 is good, expected, right? Minimize interruption to 11 seconds. I want you to do it 10 seconds. 11 seconds is too much, so this is not indicated. Immediate defibrillation. You don't need immediate defibrillation. 2 inches compression. Look at the buzzwords here. Adult client, 2-inch compression depth, at least. If you don't go at all, at least 2 inches for younger one. So this is not indicated. Epinephrine 1 milligram every 3 to 5 minutes. That's what we use for asystole. So this is expected. This is not expected. Next question. Which of the following teaching is appropriate? Select or apply. A nurse is caring for a client with what? BMI of what? 20 due to what? Chronic bloating, cramping of the abdominal pain, and diarrhea after wheat intake. So I eat some wheat, then I have cramping pain, bloating, pain. My BMI is low. What do you think? This is celiac disease. So what should they avoid? They can eat rice, but they should avoid barley. So this is wrong. They can eat rice, they should avoid this. So this is wrong. They should avoid this, but they can eat that. So this is wrong. Avoid rice and corn, they can eat both. So this is wrong. Read the, this is read. Read food label, yeah, that's good. Avoid rye and oat, yeah, because this is what they should avoid, right? Barley, rye, oats, and wheat. So this should say read food labels. So this is good. So 5 and 6 are those you should put in the teaching. This is just to confuse you. You got to go through every line and cross it over. Select all that apply. A nurse is caring for a client who is now 12 hours after right high surgery. Which of the following need immediate intervention and need to intervene? Intervention. You see, I keep on underlining because you can go wrong. You have a surgery in your right eye. The key is to prevent intraocular pressure. Okay, try to make sure it's less than 20. Therefore, I don't want you to strain. I'll give you Docosate, so I don't need to intervene, right? Order for Ondansetron. I don't want you to vomit. You have nausea, to coughing. Yeah. Avoid sneezing. Yes. Avoid coughing. Yes. Bend at your knees, not your waist. That's good. Lay on your right side. So if they have surgery on the right eye, they should lay on the left side. So this one is a problem. So there's only one answer choice there. If you pick more, you get it wrong. Next question. And this is teaching new graduate about vesicant. Okay, vesicant. And their complications. Which of the following the nurse should include in the teaching? Select or apply. Which one you have to know? This is content you have to know. Which one is a vesicant, vancomycin, phenytoin, mannitol, and norepi? I give it to you so that you can remember the in case you see them. All of them should be included in the teaching. Next question. Select or apply. A nurse is caring for 4 clients who need immediate intervention by the charge nurse. 4 clients who I need to intervene. MRSA, single-use equipment. This is contact. This is good. I don't need to intervene. West Nile virus, nurse wears surgical mask. West Nile virus is standard precaution. The nurse does not need to wear surgical mask, so you got to intervene. Said intervention. Legionary, client in private room. This is standard precaution, does not need to be in private room. So here. Rubella, what do you think? This is droplet. Nurse wear N95. Wrong. Surgical mask. Fifth disease. This is what? Droplet, right? So Client wears surgical masks in the hallway. So this is good. So this is good. So I don't need to intervene here. Fifth disease is parvovirus. This is droplet. You can walk in the hallway without anything, with the surgical masks on. But this. So those that need to intervene, 2, 3, and 4 are the right answers. The next need to intervene immediately. West 9 standard, you don't need to wear. Legionnaire standard, no need anything. This is droplet, you don't need N95. This is droplet, it's fine. MRC equipment is good. Next question. A nurse is caring for a client with the following charted in 8 hours. So this one, I'm not going to do the calculation, but I'll show you. So you have to calculate what is the net fluid. You have to know this. Okay, 1 cup is, okay, 8 ounces. It's equal to 240 ml. So 2 cups of ice, but if you have ice, which is 1 cup, it will melt into 120 ml. Okay, 120 ml. So 2 cups of ice will be just basically 240 because of 120. 3 cups of orange juice, you have 240 times 3. 1 cup of water, 240 times 1. 4 cups of pureed, you cancel it. Pureed is not part of liquid. So even if it's 4 cups, you don't add it to it. So this will be 0. That's the key. 1 cup of ice cream is already melted. So 240 ml. Then patient receiving LR, 2 ml, 30 ml per hour. So 8 hours. So 38 times 30. Then you add the total. Urine output is the same, 8 times 30. And then, so this is 240. This is 240. Then you add all of them. That will be the total fluid gain or lost. That will be total fluid. So what is going to happen is you add, the question is, what is the client net fluid gain and loss? So you add all the intake, which is 1, 2, 3, 4, 5. And then you subtract the output, which is urine output. You subtract it from it. And that will be, the answer choice will be the gain or loss. So that's the way you do it. This is a guide. You have to do the rest. Next question. A nurse is caring for a client prescribed acetazolamide. This is carbonic anhydrase inhibitor. Which of the following is expected? So you decrease your bicarb. It's carbonic anhydrase inhibitor. So you avoid formation of utilization of the bicarb. So the patient will have metabolic acidosis, right? So this is a metabolic acidosis problem. So what do you expect? This is not acidosis. Bicarb is low, so that is good. If I have metabolic acidosis, how do I correct it? Respiratory, what? Alkalosis. That means I should be breathing really fast. I will not hypoventilate. Metabolic acidosis is good. If I'm breathing really fast, my CO2 will compensate like that. So that's what I expect. The pH should be lower, metabolic acidosis, my bicarb should be lower, my ventilation should be higher in order to blow out my CO2, and metabolic acidosis, and this will be lower. That's what you expect. So acidosis, respiratory alkalosis, that's why it's like that. Next question. A nurse is caring for a client prescribed bumetanide. Which of the following need priority intervention? This is a loop diuretic. What is the number one for this patient? There's a bunch of stuff. They causes orthostatic hypotension. They have photosensitivity because of the sulfur drug. They cause hypokalemia, causes muscle. They cause slight dizziness from the orthostatic. What do you think is the most important? Is that potassium, hypokalemia, and this is muscle cramp. Okay. So that's the right answer, number 3. #71. Select or apply. Which of the following must be included in the plan of care? A nurse is caring for a client diagnosed with what? H. pyloric infection, right? What will you include? You know, this is your gastric problem, right? Affecting the stomach. It's an infection. It's the bacteria. The key is you need 2 antibiotics. Okay. You need a PPI and you need a bismuth. And the therapy is 7 to 14 days. 7 days to 2 weeks. So there's a PPI, antibiotic, bismuth, antibiotic. This therapy is too short. It will cause resistance. So 1, 2, 3, 4 is your right answer. I highlight the information that you need. Select or apply. I'm teaching you how to write select or apply. At the same time, going through the cases so that you can give you the key fact. These are facts you have to know. Which long sound, okay, is paired with the correct description? We have a long sound and description. And then she's teaching you graduate about long sound. Wheezing is an high pitch. Good. It sound like musical. A stridor is also a high pitch. Feel like you're whistling. Fine crackle, there's a coarse and fine crackle. Coarse crackles are low pitch. Fine crackles are high pitch. And they feel like something is crackling sound. Friction rub, you can see, this shouldn't be high pitch. It's usually low pitch, but it's a grunting sound. So which one is paired correctly? 1, 2, 3. This one is wrong. #75. Select or apply. Same thing. A nurse is caring for a client with pneumonia. Which of the following is an adventitious breath sound? When you hear this adventitious breath sound, is asking the way I interpret it is this is a not normal breath sound. Wheezing is not normal breath sound. When you have crackles, it's not a normal breath sound. When you have friction rub, it's not a normal breath sound. When you striding, it's not a normal breath sound. Vesicular is normal. Adventist, that means the lung itself and the parenchyma and the tracts. So adventitia. So these 1, 2, 3, and 4 are all adventitious breath sounds. #74. Who need to be seen first? Who? Prioritization. Must be sharp. And nurse is now aware of what? 4 clients in the med-surg unit. Would you want to see an itis from pancreas? Pancreatitis with a lipase of 14,000. Don't see them. An itis from appendix with a white count of 18,000. Infection. Don't see the patient. Another hiatus, infection from diverticulum, is going to have fever. Don't see. So you're left with this. It's an hiatus, but it's talking about board-like abdomen. This is a B-sharp movement. This is peritonitis. I know patient has cholecystitis, but yes, peritonitis. You need to see this first. Case form, short one. The nurse anticipated diagnosis is what? A client present to the emergency room, keywords. I told you, they always put it in the first 1 to 2 sentences. Episodic headache, 1. Excessive sweating, 2. hydrosis. Also complain of weight loss despite polyphagia, eating a lot. Temperature is this, tachycardic, blood pressure is high, blood sugar too is high. The next anticipated diagnosis will be what? Break it down. Episodic headache. So I have headache here, excessive sweating, so hyperhidrosis, hydrosis. Weight loss is despite me eating, that means metabolic rate is high, hypermetabolism, right? Tachycardia, hypertension, and my sugar is high, hyperglycemia. All this is what related to you releasing epinephrine or norepinephrine. These are our stress hormone stuff. You can say it's essential hypertension, but we have a cause. They don't cause episodic. Crohn's disease releases aldosterone and increases your hypertension. It can increase your sugar, right? But it does not cause excessive sweating, weight loss, episodic headache. Hypothyroid, we don't do that. So left with pheochromocytoma. These are the 5H: headache, hypertension, hyperhidrosis, hyperglycemia, and hypermetabolism. So this is your answer choice. Number 3. 76. Which of the following the next you expect an expected finding in hypoglycemia? Your sugar is low. Yeah, your body is not going to be happy. We try to increase it. You're not going to pee a lot when your sugar is high. You will not have ketones when your sugar is high. You're not going to have tachycardia. You sure? Yes. Your body will be not happy. Everything will go up. You're not going to have ketones. Yes, you do. You have ketones when your sugar is high, but when you have hypoglycemia, no ketones. So what do you see in hypoglycemia? Tachycardia. You don't see polyuria, urine ketones, or ketone smell. You can change this to somebody who has hyperglycemia, like DKA. You can flip the question back. The right answer is tachycardia. You don't see, you see it in hypoglycemia. That's expected finding, hypoglycemia, tachycardia. Which diet is a priority? What is the problem? A client has kidney problem, kidney injury, and is on dialysis. Well, they should avoid certain things. If you have kidney issue and you're on dialysis, you should avoid something. Sodium 4.5 grams a day, no. They should do 4, at most, just 4 grams. They should not go more than 4 grams. Potassium 6 to 7A, this is always a priority. That's what I wanted to do. Don't go past this. Fat 45% daily, they just need 35%. Calcium 2,500, maximum 2,000 milligrams per day. So they need 2,000 milligrams per day calcium. 35% of their daily carriage should be fat. Potassium should be 60 to 70, and it just need 4 grams of sodium a day. So the right answer is number 2. Select that apply. Is that right? Which of the following actions the nurse should include in the teaching? A nurse is teaching new graduate about bolus feeds. Bolus feeds, that means you have somebody has 2 feeds, you come in and bolus them you come in like 4 hours, 6 hours, and give them bolus feeds, right? You instill the formula, 45 minutes is too long. Usually it's bolus. That's the definition of bolus, sharp, very fast, 30 minutes. Administer the formula at room temperature, yeah. Elevate the head of the bed to 25. Bolus feed causes aspiration, so 30 degrees is best. 25 is still low. So this is wrong. Flush the feeding tube with warm water. Yeah, you got to flush the feeding tube to prevent it from clogging. and assess for bowel sounds, see if they thoroughly in the tube feed. So 2, 4, 5 should be included. And when you're teaching them about bolus feed, assess bowel sound, you flush it with the tube, elevate the air to 30 degrees, and bolus it to 30 minutes, and administer at room temperature. You tell them you don't check residue for bolus feed. You don't do that. It's not scheduled. You don't have to do that like that. Like you check residues every 4 hours, every 3 hours. No, for bolus feed, you don't. If they get in continuous feed here, you try to schedule your residues and see how much they get and retaining in their stomach. 79, almost done. Which of the following is the best response? Therapeutic. And this is caring for a 12-year-old baby. Initial assessment shows club foot. The parents want to know how the club foot will be treated. Simple form. Baby is just born. Parents saw club foot, right? And they ask you, how is it going to be treated? What is the most important, best response? Use specialized splint. Yes, they may need splint to achieve correction, okay? We use an abductor device for a couple of months, right? Manipulating and weekly cast, yes. They may need surgery, but not immediate. You do conservative treatment first. Which one is your best response? We start with manipulation first. Manipulating and weekly cast change. Then later on, we use an abductor device and then specialized splint. So the best one is the best. We're going to manipulate and do weekly cast change to make sure we keep the thing in a line. So that's the right one. Which of the following is a priority nursing diagnosis? Don't forget that. And this is caring for a client with the history of osteogenesis imperfecta, admitted for pneumonia. So which one is your primary priority nursing diagnosis? I've been admitted for pneumonia, but I have this bad problem, osteogenesis imperfecta. What should be your priority? Don't injure me. Okay, if you injure me, it's worse than my pneumonia I have. Pain related to fracture. I don't have fracture yet. Interrupted skin integrity until I injure myself. Self-conscious regarding body image. It's not a problem right now. The risk of sustaining injury related to the disease. Yes, he is going to fall. He's going to trip a little bit. He's going to break his leg really bad, multiple bones. He's going to be worse than pneumonia. So risk of sustaining injury related to disease states is more prioritized than the rest of them. 81. Select or apply, right? Which of the following the nurse should respect? A nurse is assessing 1-month-old infant in the ped clinic with diagnosis of what? Congenital hypothyroidism. When they give you this, they give you the answer. Don't freak out. Those are your buzzwords. Congenital hypothyroidism. That means baby born and he has hypothyroid, hypo-T. So this is not included. 1 month, they still fontanelles. I expect it to be okay. So 1, 2, and 5 are your right answer. So that's the strategy to answer this question. Hypo going down, hyper. This is classic to that. This is not going to be closed. 32. Which of the following indicate adverse effect of the medication? 15-year-old client was prescribed metamazole for Graves' disease. Which one indicate adverse effect? Think about it. Rewrite buzzword. Graves' disease. That means you have too much thyroid hormone. Everything is up, right? Right? Everything is up. So what do you think? I give you metamazole. Metamazole is going to block this. That means things will start going down, right? So which one indicate that there is adverse effect of the medication? Adverse effect. If they're losing weight, that means my medication is not working, right? That means my medication, that means the grave disease causing them to have high hypermetabolic rate and they're losing weight. If they're having a palpitation, yeah, that means their thyroid hormone is too high. Lethargy, things going down now. This is B-sharp moment. They are hypothyroid. Blurred vision, consistent with their thalamus. So this is hypothyroid, hypothyroid, hypothyroid. Signs of hypo is this one. So the answer is this is the key. Number 3 shows that there's adverse effect. 83. Which assignment is appropriate? A ped nurse floats to the med-surg unit due to nurse shortage. Pediatric go to the surgery unit. Give them somebody they're familiar with, is within their specialty, and it's not a specialized patient. I have cholecystectomy, I'm waiting for discharge. No, discharge instruction has to be done by a med-surg nurse. They know everything about cholecystectomy. Roux-en-Y 24 hours ago, yeah, there's things these people need to do, get out of bed, provide them specific teaching, diet, and all those things. Peds nurse doesn't know that. Cabbage 48 hours and has chest tube. Yeah, this is too dangerous. Appendectomy 48 hours ago and tolerating diet, nothing to do. Probably all they need is pain management. So that one is good for the ped nurse. They see people who have appendicitis all the time. So they're familiar with kids with appendicitis. 84. Which statement should the nurse include? Select or that apply. A nurse is teaching new graduate about therapeutic responses. So which one shows therapeutic? We have great doctors here. You'll be fine. Wrong. False promise. I know how you feel. You don't know how I feel. Everybody say the same. Everybody does not say the same. I'm not everybody. I'm Mr. So-and-so. Tell me more about the issue. Yes, patient is talking now. Let's talk more about the issue. Yes, patient is talking now. Therapeutic, let the patient talk and ask for more information. Don't interrupt. Don't project. Don't promise. So 4 and 5 are your right answer. And the last one for the road. Which assignment is appropriate to LPN? We have a nursing team made up of RN, LPN, and UAP. Which one? A client who require range of motion exercise Q4. This will be done by UAP. Does not require thinking. Client with G2 who require bolus feed Q4. LPN does MMR most. Check my website, it will tell you what MMR most is. They monitor, they reinforce, they give most medication, they do stoma and tube feed, so they can do that. Client who need help getting out of bed, that's UAP job. Client who need discharge instruction, that's RN job. This is 85. Hopefully you learn some content. If not, go back, sit down, go back and start learning more information. This is just a sample questions. I think if fits things if you know a bunch of them, there is a good sign. It's like a form of an assessment, predicting. This is me helping the system. Take care of yourself. If you've not subscribed, the link is down. Subscribe and then be part of the Adapt NCLEX family. All the best of luck and good luck. Once again, never stop charging. Keep charging. All the best of luck. Bye-bye.